The Somerville Foundation, Annual Conference 2014, Lifestyle Issues for the ACHD Patient, by Joe Quirk, Nurse Specialist, Leeds General Infirmary. About the speaker, Joe Quirk. Joe Quirk is an adult congenital nurse specialist at Leeds General Infirmary. She specialises in adult and paediatric congenital heart disease. Jo manages the congenital nurse team and helps patients transitioning from paediatric to adult care.
Right, everybody, I've got the pleasure of introducing Jo Quirk, who's going to be talking about lifestyle issues. Thank you, Jo.
Hello and good morning, and I know a lot of you in the audience, so no heckling please. Just listen. Oh, is it afternoon now? Straight away I've been heckled. So I'm going to talk to you a little bit about some of the lifestyle issues that affect congenital heart patients. Talk to you a little bit about the services available and hopefully give you some top tips to enable you to live a safe and productive life. So some of the lifestyle issues obviously relate to the complexity of the condition and the age of the patient and the personal circumstances. So I was just Googling like James did, and I thought this was quite good because obviously it relates to some of the young people that are in the audience, all into sort of social media, and some of us older ones at the other side. So one of the lifestyle sort of issues that we want to talk about is about sort of career opportunities. And obviously this again depends on your condition, but there are lots of many appropriate career options out there. I think for the young people in the audience, when you're considering careers, I think you've got to really think about the long-term issues of what type of career that you want to take. And to consider maybe the things like, is heavy lifting required, what stamina's needed, what about your sort of the long-term prospects, and what about whether you'll be able to continue with this career in future years. So who's available to help you get a job? Well, I think to start with, it's important that if you're not sure, come and talk to us at the clinics. The cardiologists, the nurse specialists, we're happy to sort of talk about career options with young people, if you're unsure what you can and can't do. We're happy to write specialist letters for you to support your applications. And in each job centre there are disability employment advisors, and they're sort of slightly separate to the people within the job centre. They sort of have more time for a start. They're used to dealing with anyone with a health problem. They probably don't know anything about congenital heart disease, so that's where you as experts come into that. But they are a very good, useful resource, and they're in every job centre within the country. But obviously the most important thing is to sell yourself at interview and then tell them about the heart afterwards. Because you know, you as a person have got lots and lots of qualities there. Obviously, you know, sometime over the years there may be a deterioration in your condition and you might not be able to do the job that you originally were doing. So I think the most important thing is to maybe talk to your employer about some of the flexible work patterns that are around now. And talk to them about, you know, maybe you can think about doing some work from home. Maybe you can think about reducing your hours. And if it gets to the stage where you really can't do many hours because of your health, then there are some work-based benefits we're going to talk about in a little while. Some patients unfortunately do have to consider ill health retirement, but there's lots of things to sort of think about before you give up work, because obviously there are some other benefits as well as money. And you know, most of us enjoy going to work and enjoying being with our peers and our work colleagues. So benefits is a bit of a minefield, and I think you probably all know that there's lots of changes all the time going on with the benefits, and it is quite difficult to sort of keep up to date with all the different benefits that are around at the moment. So you probably all know that disability living allowance, which some patients may get, is now this personal independent payment. Incapacity benefits now changed to the employment support allowance. But most are awarded depending on your sort of functional ability, not the complexity of the condition. I think sometimes that's difficult for some patients to get their head around, in the fact that, well, I've got pulmonary atresia, I've got tricuspid atresia, I should automatically get it. People out there don't understand all these terminologies, and one patient with pulmonary atresia might be very different from another patient with pulmonary atresia. So they very much look at the functional ability of patients. And how they're doing this now is scoring sort of on your sort of limitations. So the physical side of things is probably a little bit easier to sort of explain. So it's maybe you tie very easily, you can't walk very long distances. But some of the paperwork is very, very sort of difficult at times. And I think for most of the patients in the audience, you all look, you know, you may look at rest very well, and it's not until you start moving around the home, starting going out to think about work, is when the difficulties become. And I think the other thing that I've mentioned to patients over the years is about some of the sort of mental might be the wrong word, but the emotional sort of limitations. You know, it's very stressful living with a long-term illness, and it's important to get those things across when you're thinking about applying for the benefits. Completing the forms is probably an absolute nightmare, and I know it is because I know I've helped a few patients in the past to fill them in. And I think it's really important to get somebody who regularly fill these forms in. So there is Citizens Advice Bureau that have Benefits Advisor. There's a DIAL, which is the Disability Information Advisory line. And there are people out there in the community that can help fill in forms with you. I think the most important thing is give as much information as possible, and sometimes it can seem really, really repetitive, the information that you're putting on the forms. You might want to include some medical reports, so maybe an up-to-date scan report, clinic letter, exercise tolerance test, anything that appears supportive. And obviously we can provide supportive letters to go in with your applications as well. I think the next thing to do is don't be put off if it goes down to a tribunal, because lots of people get turned down the first time. And often it's because people don't understand about your condition, and I think if you're face to face, sometimes you can explain it a little bit more. So, you know, go there and sell yourself, as it were, but it's probably just because people don't understand your condition. Again, a problem with prescription charges. So it's probably been a big discussion in these conferences over the years. It's unfair, it is costly, and unfortunately most patients aren't exempt. You might want to consider an annual payment, which you can pay by monthly direct debit. You might have a very supportive GP, maybe who can help how they complete the prescriptions. You know, rather than just a monthly prescription, they might order you enough that will last you then a couple of months, if not, because it is very expensive, and we understand that. So travel, going on holiday. Most patients travel around the world. I think the most important thing is for everybody to do it safely. There's some things that maybe you need to consider doing before you go to book your holiday. So, you know, the obvious thing, where's the hotel? Consider what the access is like. Check that the hotel isn't on the top of a hill, because obviously at the end of the day on the beach you don't want to be trekking up a hill. What's the length of your flight? Maybe you'll need some supplementary oxygen, and just remember some airlines charge for this. Over the years, less airlines charge for it, but there is some of the sort of the budget airlines still charge quite a lot. Think about the size of the airport that you're travelling from, but you can request assistance, but that has to be done in advance. It's really important that you mention your condition to the insurance companies. I think most people sometimes some people think that maybe you're automatically covered, but you're not, and you need to explain that. Scars, I just mentioned the fact that scars can burn, so the use of sunblock's really important in the sun. And I just mentioned a little bit about medication supplies, because this is important that you have enough when you're aware, but obviously warfarin does affect some of the activities you might consider doing, like skiing or skydiving or some other ridiculous activity that I'm glad I don't have to do. Just mentioned about scars. Most people hopefully wear them and are proud of them, and it's who they are, but sometimes you might want to cover the scar. There might be a special occasion where you've got a wedding or a prom or somewhere that you want to go and you want to just cover that up. There used to be a camouflage clinic run by the Red Cross. It's now run by a charity called Changing Faces, and they have a really good website, and you can either self-refer or the GP or your nurse specialist can refer you. And what they do, they see you in the clinic, they look at your skin colour, they mix up the makeup to the exact skin colour, they show you how to put it on, and then you get your prescription from your GP. And then when you put the actual makeup on, it can stay on for a few days. So I think it's waterproof as well, so I think you can swim with it as well. So it's again something that you might want to just consider. I think piercings, the risk of endocarditis has been mentioned earlier. People do get tattoos, people do get piercings. We obviously would advise against it because of the potential risk for endocarditis. Exercise again has been mentioned before. We all know that we should be doing more than maybe some of us are, but it is important for our general health. It helps to prevent weight gain, but it's good psychologically as well. And you know, I think the message is today is that everyone can exercise within their own limitations, really. Anything, you know, I think people in the past thought exercise was about going to gyms. Well, it isn't. It's about maybe going out for a walk. It's about maybe going for a gentle swim. And ask for help if you're unsure how much you should be doing. In Leeds, we run a healthy living group. And again, we called it a healthy living group because we thought if we called it an exercise group, nobody would want to come. So we called it a healthy living group. And then when they walk through the door, then we've got this gym. 100 random goes, but no, they don't. So we've called it a healthy living group because it was important about promoting exercise and activity, but it also is a good way of patients to exercise together in a safe environment, maybe just to build up a little bit of confidence, especially maybe if they've had surgery or they need to get fit for surgery, or they just want to know exactly what they can and can't do. And the physio, Sarah and I run that group. We only run it once a month because patients live such a long way away, and then we give some advice in between. So we always say to the patients, it's really good that you're here, but exercising once a month is not going to get you fit. But, you know, it's a really, really good group and it's very informal. So anybody who comes to the Leeds unit is very welcome to attend that.
Do they do that at Leeds LGI?
Yes. And then last year we did a pedometer challenge because we thought that we'd get people walking a bit more. So we staff, patients, children and parents all wore pedometers for a month last September, and we all recorded our steps and we sent all our emails to James Oliver. So he was really pleased to get 100 or 150 emails on a Sunday night. And then they uploaded all the steps, recorded it, and then he tracked how far we walked. And as a group, we walked to Afghanistan. So we were really pleased, and it was a really good thing to do. So who's available to support and advise you? Then obviously there's cardiologists in the clinic. They provide copy letters of your clinic visits for your use, so that's useful to keep that information, especially if you're going to see local services, applying for benefits, that sort of thing. Obviously I'm going to sell the role of the nurse specialist because I'm stood up here, but we are based in all the centres, and I think it's really important that you use the services. It keeps us in a job. And also, you know, we have an extra role that complements the role of the cardiologist. And we would hope that you would use a nurse specialist via emailing questions that you might have, using the telephone advice line, and obviously we're trying to be in clinic as well to support you, especially around some sort of event that's happening in your lives. The physiotherapist, they're based in most centres, they're not all specialist physiotherapists, I must say. We're very lucky to have one in Leeds, but there are some within your centres and it's worth asking, and they can help you with exercise advice as well. Psychologists, we're very lucky to have 2 psychologists and a counsellor that works within our team, and I know Jane and Rachel are going to speak after me. So, and some of their work, I think, is helping patients work around some coping strategies, change of events in their lives. And then obviously we need to promote the Somerville Foundation today. So really, I think it's just to say, achieve your goals in life, and it's okay to ask for help along the way. And that's me, thank you.
The Somerville Foundation, supporting young people and adults born with a heart condition. The Somerville Foundation works with patients born with a heart condition, congenital, providing practical and emotional support and enabling them to take control of their lives and manage their own heart condition. Thanks to advancements in medical treatment, today more and more people born with heart conditions are living full, long and happy lives. To learn more about the work of the Somerville Foundation, visit www.thesf.org.uk.